Happy National Dental Hygiene Month. To all our fellow hygienists out there creating a healthy impact in the community, we applaud you. We know how much of a difference you make both in and outside of the op. For those moments in the op, there are items and products which help you create that impact. On this episode of RDH Coast to Coast, Tina and Kim share some of their favorite items to have on hand, which help them create the positive impact for their patients. So friends, grab your headphones, take a breath, and see if your favorite is on the list. Oh, Kim, and again, here we are working through another wonderful episode with you of our break time chats. How are you today?
Good. Another sun shining afternoon. I can soak it all in.
Yes. And I have to say in Oregon, it is the summertime is normally when we get to have sun. And I know this is not airing in summer. It will be airing when fall comes. I'm hoping that we'll still have some of the remnants of fall or some of that sunshine, but who knows? But it's like one of those things that when the sun comes out, I just can't live without it. I'm like, I gotta be outside. I find every opportunity to just soak it all in. And I think that makes me kind of think of like things that you just can't live without on a regular basis. Like I'm a solar powered person. I cannot live without it. I got to take my vitamin D. But when we take it in the world of dentistry, there's things that we just can't live without, right? So is that for you, Kim? Do you have things within your clinical life that you just can't live without?
I think that would go for all hygienists, right? I think all of it type A.
Right.
And there are certain things that we need to have, or certain things that need to be in certain places that we have to have in order to do our job every day. Or like you walk into your operatory and sometimes you can just tell somebody else was in here. Something's different.
Oh yes, that is like when it's been organized. Like that is absolutely like organization. Like everybody has their own organizational flow. Gotta have it, right?
It does. It does. And I think too, having those certain products or having those certain things that you like to use day in and day out, you can feel lost without it. So tell me, what's something that is absolutely a necessity for you when you're working?
Oh gosh. Okay. Well, the very first thing, I don't know if I can rank this, but the first thing that popped into my mind was when I am doing the coronal polish air. I have a cordless polisher in my operatory and I love it. And when I go into another operatory that does not have that cordless one and I'm using it, I'm like, ugh. So hands down, cords away. Having that cordless polisher has made my life so much easier, so much easier. I
Really?
love it.
And what brand do you use?
Oh, okay. Well, the one that I have is it's Pacdent's
Okay,
cordless
nice.
polisher, and I love it. It's nice. It's easy to hold, and I can use it all over the place, and it's quiet too. And I think my patients actually made comments. They're like, "Oh, this is different. This is, they're like, and
Oh,
it's a lot quieter too." And I've
yes.
noticed that too. Like, so like ear noise, right? We talk about hearing health a lot in dentistry. So that's been a huge thing for me. So I would say that's definitely one of them. What about for you, Kim?
I will say I started working with a saddle stool with an arm. And
Oh, yeah.
I cannot work without the arm. It is so good to be able to rest my elbow, if you can't see, but I'm actually doing it. With my non-dominant hand, whether I'm using that hand with the mirror in a certain area of the mouth to be able to rest my elbow, or if I'm not using it, just to have a spot to rest my arm. It has helped tremendously with my ergonomics, and I really don't know if I could work without it anymore.
Okay. Now, is there a specific brand that has that, or have you seen that on a lot of different saddle stools?
So I originally was at an office that had it and they had both arms, but I only used one. I
Hmm.
don't, and I couldn't find the brand of the
Okay.
saddle stool. And I knew I needed it, or I knew I needed the arm. So I went to a trade show and searched around. I believe mine is RGP is the
Okay.
brand.
Okay.
And I ordered it for myself, and I was the one that showed up on my first day wheeling in my own chair.
So you bought your own chair.
I bought my own chair.
Oh, you hear that, friends?
I
She
did.
bought her own chair. Look at you, a trailblazer, spending your own
You want to hear
money.
what else I bought too? This is another product that I can't live without. I am team ultrasonic, and my office all has piezos in the units. And the piezos that we have, I don't know why, but they sound like nails on a chalkboard. You can hear it down the hall, whoever is using their piezo. So I also invested in my own capture. And I have it on
Ooh,
the cart, and I wheel it right into whatever room I'm working in. I come with my chair and my push cart, and I set up for the day.
that's awesome. Now I know that this is kind of a little off topic, but for those of people that are like, what, you bought your own, right? That can be considered a business expense that you could put on your taxes, right?
Absolutely.
Right. Yeah. So double check. I'm just going to throw that out there for people who are like, oh, I can't, my doctor or my office won't buy it for me. But just kind of think about it, double check with your state, because you might be able to put that as a tax little benefit write off. So we'll put that out there just for
Right.
the curious minds.
And instead of saying my office won't or my boss won't, if it's important to you in the long run, tuck some money aside and invest in yourself. There's no
Yeah.
better way to treat yourself than to invest in something that's going to either let you practice comfortably for many years to come, or is going to make your own personal job maybe a little bit easier. But for me, I have back problems. I have scoliosis. I knew I needed to have a certain chair. And actually, I was able to use my flex spending through my health insurance to
Perfect.
purchase my chair.
Nice. That's
Yeah.
great. Okay. So, I will say this. I do know what my number one thing is that you would have to pry it out of my cold, dead hands.
Oh, what is it?
um, I could not live without my loop light. Now, I
Oh,
love my magnification. I
fun.
do, but there is something about having my loop light and being able to see, not having to worry about the overhead light, but like having exactly what I'm looking at illuminated is amazing, amazing, amazing. And I've had moments where, like, the cord has gotten dinked or the light bulb burnt out, but I will say I've had my Q Optics for 13 years. For 13
Yeah.
years, and they stand by their product. And I had that light bulb burn out one time, and they replaced it. And that time frame that I had to go without my light, I was like, oh,
Yeah.
this sucks so
Yeah.
hard. It
You
sucks
can't see
so hard.
anything. You
No, you
really
can't,
can't.
because right, you're like, you've got these silver instruments in a dark hole.
Yeah.
Yes. So I would say absolutely loop lights. And so for anybody who's like loop light, schmoop light, like you haven't used it.
Right. Right.
Right.
And there's all different kinds. I had a corded loop light. I now have a wireless one through
Ooh,
I don't know, I can't think of their name. I'm sorry.
that's okay. That's because nobody pays us to talk about this stuff, right?
Orthoptic. There it is. I have the
Okay. Yeah.
cordless light. I will say it's not as bright as my corded light, but it does well. And I couldn't live without a light
Yeah.
either. I
Yeah.
couldn't live without my loops either. I have noticed that I'm blind as a bat. It's like, wait, you want me to look at the tooth the regular size?
Yes.
I can't see anything.
Have you invested in the ergo loops that have that little 90-degree tilt? Yeah, I haven't either. And I have some students that have them. I have some colleagues that have them. And I'm like, I look at them and I'm super jealous of their ergonomics. I'm like, look at you, just like all nice, upright, and just kind of like looking doo-doo-doo-doo-doo. And
Right. Well,
yeah,
similar to you having your loops for a long time, I've had my pair of oroscopic loops for 12 years. So
right.
at some point I'll be due to upgrade. I don't know if I will do ergonomic. I don't know, but it's definitely an investment that I will be making in the near
Yes,
future.
yes. And I did buy my own loops. I did, for
Yeah,
sure.
same.
Yeah. Yeah. Okay. So what about, let's go into like instruments. I know you said your ultrasonic, your Cavitron, but what about a hand instrument? Is there a specific type of instrument that you're like, if it's not on in the cassette, right? Hopefully we're all using cassettes, but if it's not in the cassette, I don't know if I can do my job.
Yes. The Nevi, either a Nevi 4 or, the Montana Jack, that posterior curved sickle. I can't live without it.
Right? I know that's
Yeah.
how I am too. I'm like, where is that nice thin contra angled instrument that you can work it in the anterior, you can work it in the
Work it
posterior.
anywhere.
Yeah. Yeah, it is a beautiful, beautiful instrument. I agree. I have to have that as well. I must have that. And I don't know about for you, but our universal instruments like a Barnhart 5.6, is that a big? Somebody told me that there's West Coast instruments and East Coast instruments. So I was like, oh, I haven't heard that, but I think it was Amanda on one of our
Yes.
episodes. Yes, it was Amanda that said that there's East Coast and West Coast instruments, but the Barnhart 5.6 is another one of my staple instruments that I love to have.
So the Barnhart is my absolute favorite out of when I first graduated. I invested in some of those myself, and I brought them into, if I was temping, I brought it in with me to every office that I went to. It was, and I say this to my students in school, they're always afraid to pick up the Barnhart. But it's a great instrument, and it really can, save you time by using a universal instrument for light calculus throughout the mouth. So that's absolutely a great instrument as well.
Cool. Yeah. All right. Now, what about fluoride varnish? Are you when you apply fluoride varnish, I'm assuming that you apply fluoride varnish because most people do use varnish now instead of the foam.
Yes.
Is there a particular what is it that you look for in regards to that? Because I know I'm starting to become particular with my fluoride varnishes. Are you?
Yes, there is. I should have written down companies before this.
That's
Well,
okay.
the company that came out with the one that you don't have to dry the mouth, and it's not sticky, and you can eat right away after.
That's the one I was going to say. It's
Yes.
Kettenbach's Profil.
Yes.
Yeah, as they call it, it's lubricious, right? You can put it on and it's not sticky. Like you can bite down and your teeth don't stick together. Yes.
I got the opportunity to try that at RDH Under One Roof, and I brought a box back for everybody in my office to try because I'm like, we need to get this. It's fantastic.
Yes. And on one of the things I thought was interesting about theirs, and it'll be interesting to see if we start seeing a trend with the fluoride varnish companies, the different companies, is that they have an unflavored one, like something about their formulation. They were able to make an unflavored one. So the people who are like, do I have to pick a flavor? Like
Right.
there is something out there. And the unflavored one actually isn't too bad. I've had it. I was like, oh, wow. It's like, I mean, of course there's a flavor, but it's not like minty. It's not melony. It's not berry. It's not bubblegum.
Right.
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 But it's not, it's a very neutral kind of, I don't know how else to explain, a very neutral flavor. So yeah.
Yes, and more comfortable for the patient.
Absolutely. Absolutely. For sure. Gosh. Anything else, Kim, that you can think of that?
One more is an intraoral camera.
Oh, yes. Mm-hmm.
Right. I pushed for those to be in every operatory in my current office. The mouthwatch camera is so easy to use. It's literally plug and play.
That's the one that we have at my office too.
Yeah, and the images are great. They come out fantastic. And I love to be able to do a before and after of a, calculus wall on the linguals of the lower anteriors to show the patient. I just love being able to pick it up and, failing restorations or using it for anything.
Yeah, the office that I work at, we have that mouthwash one, but at the school, we have the SoproLife one, which is really cool too, because you can do like a caries detection mode on there. So you can see like different levels of mineralization. And they have one where there's like a perio diagnosis mode, or like, so like when you put it onto that one, you can see the inflammatory ridges of the margin and of the papilla as well.
Yes. Yes. Oh, that's awesome.
So that's been really fun as a great educational tool.
Absolutely.
For not just for the patients, but for the students as well. So they're like, oh, okay. So you can look at it under regular light and then see where the camera picks up the different colorizations, and they're like, oh, okay, I see what you're talking about. That's inflammation. That's
what a great learning tool.
Yeah. So I think SoproLife. I think as I'm making faces, I'm like, I'm pretty sure that's the name of it. Yeah. See, this is what happens. We're like, let's talk about things we love on the op. And we're like, what's the names that I was just grabbing? Yeah, for sure. Oh, and of course, I wouldn't be me if I didn't also say like some sort of pain management for our patients. And everybody asks me, Tina, what's your favorite non-injectable topical? And I'm like, I can't pick because they all have a purpose based off of our patients. So that one's hard for me. So
usual go-to.
Huh?
What is your usual go-to?
Well, that's the thing, Kim, is as I have my benzocaine, I have the gingicane that I have my Cetacane that I use. We have the Orachix in there as well. And I've got the Diclopro as well. So honestly, it depends upon what the procedure is and what the patient's health history is in order for me to select it, because that is a little bit of a different medicament we're working with there. So, it's hard. It's like, so if you were saying, hey, what are you going to, if you have a patient that has to have laser therapy, like your office is doing soft tissue laser therapy management for sleep apnea, what are you going to pick? And I'm like, well, the Cetacane spray or the Diclopro mouthwash, like those would be your two big ones. So, but gosh, that's a continuing education course right there.
Exactly. Exactly. Does your office provide you with all of those different choices?
Yes, they do. Thanks to me. Because that's my topic, right? Is local anesthesia pain management. So I've created relationships with several different companies who also help, say, hey, try this out. So, and then they say, Tina, which ones should we get? I'm like, yes. Look at the patient's health history and use the one that works for that patient's health history and for the procedure. So,
well, that is great to know.
Yeah, for sure. Any parting words, Kim, of last minute ideas that everybody should look into, or one that you're like, you know what, that is a good tip, or anything like that?
I would just say, if there is something that you are passionate about having in your operatory, don't be afraid to invest in it.
Yes, absolutely. Absolutely. I agree. And same thing, I would say, especially if it is something that will benefit you physically long-term.
Exactly.
Right. If this is something where if it's like product for the office, maybe, yes, I could see why you might want to do that for the patient. But if it is something that's going to help you with your career longevity and help you be able to provide the highest quality of patient care, definitely consider investing into it with your own dollars. And then should you have to leave, you just know you take it with you, and make sure that the place knows, like, this is mine, like, label it.
Nobody else use it.
Yeah. Well, wonderful. Thank you, Kim. And thank you, listeners, again for joining us. And here's Tina and Kim saying bye-bye. We'll see you next time.
See you next time.
Thank you to our sponsor, Dental Post, the nation's largest dental job board. Be sure to check them out for different types of employment resources. Also, don't forget to like and subscribe to this podcast. And make sure you follow Tina and Kim on all the different social medias to learn other tips and tricks related to dentistry. Until next time, have a great day.